The nurse cares for a 2-year-old boy whose mother is worried that he is not fully toilet trained yet. The mother is worried because he is not yet able to hold his urine for more than a couple hours, but is proud that he can use the toilet for bowel movements. How should the nurse reply to the mother? A. Your child could be developmentally delayed and should have achieved full toilet training by now. Let me refer you to a pediatric psychologist. B. You should tell your son no every time he wets himself. That is the only way he will learn that his behavior is not acceptable. C. Bladder control is usually achieved before bowel control, but he is on track to become fully potty trained. D. Bladder control is usually achieved after bowel control, but he should be fully potty trained by this age. E. Bladder control is usually achieved after bowel control, so toilet training can take anywhere from 2 to 3 years to fully achieve. The answer is E. Bladder control is usually achieved after bowel control, so toilet training can take anywhere from 2 to 3 years to fully achieve. Toilet training may be achieved anywhere from 24 months to 36 months, and may sometimes take longer for boys than girls. Bladder control usually occurs after bowel control. Parents should not be concerned if their children take the full 36 months to become toilet trained or if they have difficulty holding their urine longer than a few hours due to the small size of their bladders. Toilet training that takes longer than 3 years may be caused by psychological factors, but this child is not in need of the assessment of a child psychologist at his age. The nurse should not encourage the mother to tell the child that his behavior is unacceptable because it is not expected of him to achieve full toilet training for another year. What is a normal hematocrit for a newborn? A. 45 to 65%. B. 60 to 80%. C. 35 to 40%. D. 50 to 75%. The answer is A. 45 to 65%. Normal hematocrit in a newborn is 45 to 65%. This is measured via heel stick just after delivery. This test is useful in assessing for anemia, suggested by a low hematocrit, and polycythemia, suggested by a hematocrit over 65%. Which of the following should be encouraged in a person presenting with mastitis? A. Go to urgent care if a high fever develops. B. Wear a loose-fitting bra. C. Breastfeed as much as possible. D. All of these are correct. The answer is D. All of these are correct. The most common treatment for mastitis is frequent breastfeeding, along with rest and loosening of any tight-fitting clothing. Most cases of mastitis are non-infectious and do not require antibiotics. However, high fever can be a sign of infectious mastitis, and may require pharmaceutical intervention. At what age does an infant learn object permanence? A. 6 to 8 months. B. 2 to 4 months. C. 3 to 5 months. D. 5 to 6 months. The answer is D. 5 to 6 months. Object permanence is the understanding that an object still exists even when it cannot be seen, heard, or touched. It is often tested by placing an object on a surface, then covering that object and allowing the infant to attempt to uncover it, thus demonstrating a knowledge that the object remains present though it is hidden. Which of the following is not a part of the Apgar score? A. Appearance. B. Respiration. C. Activity. D. Gurgling. The answer is D. Gurgling. The Apgar score is a test of newborn health and physical function, designed to assess a newborn for need of emergency assistance. The factors used to calculate the score are the following: appearance, pulse, grimace response, activity, respiration.